Hey everyone, welcome back to my channel Dental Cafe. If you are new to my channel, then don't forget to subscribe and hit the bell icon for the latest video. So today we are going to discuss about the implant supported mandibular overdenture, one of my very favorite topic. Okay then, let's begin the video. What is overdenture? Any removable dental prosthesis that covers and rests on one or more remaining natural teeth, roots of the natural teeth, and or dental implants. Any removable prosthesis which rest on teeth roots, and implants are called overdenture. Means over the implant, over the dentition, over the root. That is why it is called overdenture. Talking about the natural teeth, then canines are the ideal one for the overdenture. What are the indications of implant supported overdenture? First one, a patient who have parafunctional habits leading to recurrent soreness and instability of prosthesis. Parafunctional habits like bruxism. In such patients, conventional denture doesn't work. It leads to soreness and instability of the prosthesis. So in such cases, overdenture is a good treatment option. In patient with active or hyperactive gag reflexes, how overdenture work in cases of gag reflexes? Because in maxillary overdenture we don't have palate, we'll cut the palate part. That is why it is good for the patient who is active gagger. Third one is the poor oral muscular coordination, such as in cerebral palsy, Parkinson. The patient who have cerebral palsy, Parkinson, conventional complete denture doesn't work. Overdenture is a good option in such kinds of patient. Then the condition where retention is difficult to obtain with complete denture. In cases of xerostomia or siloria, in cases of poor residual ridge, in cases of congenital deformities like cleft palate, in all these cases, conventional complete denture, with the help of conventional denture, it is difficult to obtain a retention. In such cases, overdenture is good to work. The contraindication, first one is the if the patient is having myocardial infarction, any valvular prosthesis, patient has severe renal disorder, any treatment resistant diabetes. In short, we can say any medical condition which doesn't allow implant placement is the contraindication for overdenture also. Generalized secondary osteoporosis, in osteoporosis cases, how you will place an implant? It is absolute contraindication. If you don't have enough amount of bone to place an implant, then how you will give a overdenture? Then drug addiction, heavy smoking habits, chronic and severe alcoholism. Advantages of implant supported overdenture. First one, minimum anterior bone loss, as it prevent bone loss. As we know, after extraction of mandibular teeth, there is an average 4 mm vertical bone loss occur in first year. But if you are giving an overdenture, this resorption may be as little as 0.6 mm over 5 years. It means bone loss is reduced to a many times, mean n number of times. Of course, it improves aesthetics, improves stability, improve occlusion, improve chewing efficiency and force, improve retention, improve support, improve speech, because it will limit the movement of the prosthesis. So it will improve the retention, improve the supports, and improve the speech. Prosthesis size, at it will eliminates the palate flanges, so the size of the prosthesis is reduces. Disadvantage of implant supported overdenture is greater abutment crown height space is required, as it required a space for the implant and then for the attachments and for the acrylic part of the complete denture. So we required at least 14 mm of space from the bone level to the occlusion. So it required greater abutment and crown height space. And the next disadvantage is long-term maintenance. At the housing of the o-ring where after every 6 months, so we have to replace it after 6 months. So it required a reline and replacement of the attachments. So it's a long-term maintenance. Continue posterior bone loss, because for overdenture implants are placed uh, in the anterior region, that is for mandible between the mental foramen. So there is a continuous posterior bone loss because we are preserving an interior bone, but in posterior the bone loss is continue. Then the last one is the food impaction, because we eliminate the flanges, so there is a chances of food lodgement uh, under the denture. Evaluate the space for the overdenture. This is very important before planning for the overdenture, either for mandible for the maxilla. You have to evaluate the space available for the overdenture. So look at the figure. We have a alveolar bone, we have a soft tissue, then we have a bar and a clip, and we have a o-ring attachment. So if we are considering from a bone level, so from bone level to the occlusion, we require at least 15 mm space. There should be at least 15 mm space from bone level to the occlusion plane for the bar attachment, acrylic of the denture and the teeth. If we are measuring from the soft tissue level, then we require at least 12 mm space between the soft tissue and the occlusion plane to provide the sufficient space for the bar attachment and the teeth. So how this space is divided between the soft tissue, bone, bar and clip, o-ring and the tooth. So look at the figure. So in figure, as you can see, from soft tissue level to the bar, we require 1 mm space. From bar and the clip, 3 mm space. Bar and clip acquire 3 mm space, as you can see in the figure. And from bar and clip or o-ring attachment to the tooth, we need a 8 mm space. So in total 8 plus 3 plus 1, this is total 12 mm, that is 12 mm from soft tissue level to the occlusal plane. This is how it is divided for the attachment, for soft tissue and for the tooth. If you are considering from bone level, if we are calculating from bone level, then how you will calculate? From bone crest to soft tissue, 2 mm, bar plus o-ring, 5 mm space, and for tooth or acrylic part, 8 mm or more than 8 mm. So total 8 plus 2, 10 plus 5, 15 mm. So we required 15 mm space from bone to the occlusal plane for attachment, for o-ring. I think now it is clear how we will how you will calculate the space required for the overdenture. How you will select the site for the implant placement, at which area you're going to put an implant. So there is a specific site for implant placement for mandibular over denture. Implant are placed between mental foramen. So mental foramen is somewhere between first and second premolar. So you will place the implant for overdenture is between the mental foramen. Why between the mental foramen? As you can see in the figure, we have a mental foramen. So why between the mental foramen? Because bone height availability is good between the mental foramen, and we have a optimal density of bone. The density of bone we required for the implant placement is good between the mental foramen, and good bone height is available between the mental foramen. Bone available between mental foramen is divided into 5 columns starting from the right side of the patient. So we'll divide it into A, B, C, D and E. This is how we will divide the overdenture classification based on the site of placement of implant. Various treatment options available for mandibular overdenture. and which is classified as overdenture 1, that is OD1, OD2, OD3A and B, OD4 and OD5. In overdenture 1, type 1, we will place implant in B and D position. Why B and D position? Because if you want to place an independent implant or independent attachment, so best position is B and D, because this position limits the forward rocking of the prosthesis during function. We have only 5 position. Either we can place in A, B, C, D and E. So of course we have 2 position left, either A and E or B and D. So between A and E and B and D, B and D is the best position to place an independent implant for overdenture 1, because it limits the forward rocking of the restoration. As you can see, 2 implants are placed in B and D position, and will give a independent O-ring or ball abutment attachments. The implants and the attachments are independent in overdenture 1. We are not going to splint the implant. They are independent. In A and E position, there is a reason, because if you are going to place an implant in A and E position, the span between the A and E position is long. There is increase in the flexibility, there is greater rocking of the prosthesis, greater leverage forces that act against the implants. So that is why B and D is the safest and the good choice for placement of to independent implant for O-ring attachment in case of overdenture 1. Indications, or what are the requirements for patient selection criteria for overdenture 1? First one is the anatomical condition that are good to excellent. Anatomical condition should be good to excellent, good bone density, good bone height available in the anterior region. Then posterior ridge form is an inverted U shape. And conditions where retention is difficult to obtain with complete dentures, we can use overdenture type 1, because such as in case of xerostomia, in many other cases where it is very difficult to obtain a retention. Advantages, it is cost effective. If you are comparing to the other types of overdenture, it is cost effective because we are using only 2 implants, so it is very cost effective as compared to the other options. Existing denture can be rebased with the attachment components. We can use conventional denture after placing the implant. We can use conventional denture over these attachments. We can rebase it and use it over as a over denture. And hygiene maintenance is easy. Disadvantages, frequent relining and change of attachments required. If one implant is not parallel to other, the processes will wear on other attachment faster. As you can see in the figure, if the one attachment is not parallel to the other, the prosthesis will engage the higher attachment first, and the lower attachment will not engage, which will result in the entire force on the higher one attachment. This will result in screw loosening, increase the risk of bone loss and implant failure. I hope overdenture type 1 is very clear to you. Overdenture type 2, 3, 4 and 5 will be explained in the next video. Don't forget to like, share and subscribe my YouTube channel and hit the bell icon for the latest video.